July 11th is celebrated as the World Population Day, and right next day, on the 12th, we continue discussing the global population-related problems. Last year, we were together, happy to be with you this year as well. Unfortunately, due to COVID-19, we were able to come together on an online manner because the COVID restrictions continue. But there is one question in the minds: even if the COVID-19 pandemic is over, will these online seminars continue? I think they can, because it's a lot more practical, that's for sure. Even if we are in various other cities or even countries, digitally, we are able to get together, ask our questions, and even find answers to our questions. Therefore, at least in my humble opinion, this is a gain of the pandemic, although the process has been quite challenging for us. So after the last 1 year, today we will discuss a more specific and a special topic, which is reproductive health. We will approach the topic from a multidisciplinary manner. We will lend an ear to the experts, to the qualified people, while they will share their experiences and know-how in their respected fields. But before that, to summarize, the last 1 year during the pandemic affected everything, and it affected reproductive health as well. And it presented changes and differences all around the world. How? Just like there are drastic changes and differences between the Western and Eastern world when it comes to combating pandemic, the same difference presents itself in the reproductive health field as well. The recent researches indicate that the developing countries are faced with drastic challenges when it comes to having access to reproductive health services, starting with girls and the women. So it shows that there is a poor and negative impact on their health. However, compared to this type of countries, on the other side of the world, in the European countries, including Turkey, the birth rate is decreasing rapidly. So in the Western side of the world, when it comes to having a child, we see reluctance among the people. So how to tackle these differences, especially in these sensitive areas of the world and vulnerable places in the world? How can we handle the situation, and what's the approach of Turkey? We'll all discuss these in this seminar together with distinguished panelists. In a minute, I will give the floor to the UNFPA Turkey representative, Mr. Hasan Mutashami, and for the opening speech, I will give the floor to Dr. Kanuni Keklik, the head of the Migrant Health Department under the Ministry of Health of the Republic of Turkey, who will talk about the practices and approaches of the ministry. And right after that, we will have a panel for adopting a multidisciplinary panel. And one of the panelists is Mr. Seytan Yildirak from the Strategy and Budget Office, affiliated directly to the Presidential Office, who is a strategy and budget expert. And he will talk about the impact of pandemic on the development and demography. And then from Hacettepe University Institute of Population Studies, Professor Banu Ergöçmen is the next panelist who will talk about COVID-19 and fertility. And Nurcan Müftüoğlu from the Turkish Family Health and Planning Foundation, and Sema Sefer Sümer from the World Bank, and from UNFPA Reproductive Health Programs Coordinator, Dr. Gökhan Yıldırım Kaya are also with us today. Welcome, everyone. Thank you for being here. This is such an important day. These are such important topics for the future of the world, for the public health. And we have simultaneous interpretation, which I would like to underline. Therefore, you can follow our stream in English as well. And with this, I would like to give the floor to Mr. Hasan Mutashami, the Turkey representative of UNFPA. The floor is yours. Thank you.
Thank you very much, Simge Hanım. Thank you so very much for taking the job of moderating this function today. We really appreciate it and honored to have you on board. At the beginning, I would like to recognize the presence of our government counterparts who has graced this function with their presence and speech from Ministry of Health, Head of Migration Unit, and Migrant Health Department, and also from Presidency Strategy and Budget Office. We have some other colleagues from Hacettepe University, World Bank, Turkish Family Health and Planning Foundation. I recognize all of great participants, and also I welcome all the participants who are online and joined us for this function today. Thank you so very much, and welcome to this event. As Simge Hanım mentioned, 11th of July is commemorated as World Population Day since 1989. So each year on this day or around this day, we arrange dialogues and discussions and events and functions to discuss issues around population dynamics based on the specific context, of course, in each country. And each year, there is a theme that the whole discourse or dialogue on that year is shaped around that specific theme. This year, it will not be surprising if we talk about COVID and its impact on sexual and reproductive health and rights and population dynamics. COVID has dominated our lives during the last 1.5 years and has had significant impact on all aspects of human life and societies, from economy to personal spaces and sexual and reproductive health issues. So it really makes sense to reflect on what was the COVID, or what is the COVID impact on the issues such as sexual and reproductive health and population dynamic. Usually in the past, we knew that during a crisis, usually fertility decline happened, and this has repeated in almost all cases of crisis in the past, whether it's natural disasters or civil crisis or things like that. We knew that fertility will be declined during that period, and that the COVID period was not the exception. And we have noticed in many parts of the world, including Europe and Turkey, a sharp decline in the number of births here. Now, we need to reflect on it, we need to talk about it, and we need to think about it, what would be the best approach of the health system to this. What UNFPA is talking about is that, let me read the statement clearly: rights and choices are the answer. Whether baby move or baby bust, the solution to changing fertility rates lies in prioritizing reproductive health and rights for all. That's the basic message we have at UNFPA for the entire world, for the whole governments and communities and civil society and academia. The whole point is that, I have said it before, the theory of change is that we need sexual and reproductive health and rights to achieve women empowerment, gender equality. Without sexual reproductive health and rights, we may not achieve women empowerment, gender equality. And if we don't achieve women empowerment, gender equality, we will not be able to achieve development, economic growth, peace, and prosperity. That's the theory of change. Sexual and reproductive health and rights is needed for women empowerment and gender equality, and women empowerment and gender equality is needed for development, economic growth, and peace and prosperity. These are the chain that we cannot ignore. Now, We appreciate there are different types of policies, there are different types of times in the timeline of each country or context. Some countries are have policies to have higher population growth, have higher fertility rate. That's the rights of all governments to make that decision, like Turkey, like Denmark, like Japan, like Korea, Canada. Many countries are pushing to have a higher population growth and higher fertility rate. We are, on the other hand, we have governments and countries that they wish to have a lower fertility, a lower population growth. Such as Pakistan, for example, they wish to have a lower fertility, lower population growth. Irrespective of what governments decide in terms of having higher fertility or lower fertility, our message to all governments and civil society and academia and women NGOs and other actors, stakeholders, is that the rights and choices of women should be respected. Irrespective of the population policy, let's provide women with information and services that they need, and then they will make the right choice. Women are wise all over the world to make the right choice about their fertility, how many children they wish to have, and when they wish to have it. That's the rights of women, and we, governments, UN, civil society, everybody else, all the stakeholders, as duty bearers, we are responsible to ensure that this information and services are provided for women and girls around the world, and then they make the right choice based on their personal and family circumstances. So UNFPA should not and will never prescribe to the recommendations that only one child, or this is not the right approach. We do not prescribe that approach. We need to ensure that women and girls are provided with information and services, and then they make their own choices. And usually there is a reverse phenomenon after the crisis is over. And we have seen it in several places around the world. So fertility decline during COVID, it is expected that will bounce back with some level of increase in fertility in the coming years. And at the end, let me just also again thank and appreciate everybody who has joined us in this event of today, and apologize that we still doing it online. Turkish government has done an outstanding job in vaccinating the population in Turkey. I think among the top, I don't know, 5, 3, 10 countries in the world with the good coverage of vaccination against COVID, but still there are some variants are moving around, and we thought it's better to be on the safe side and have it online this year. Hopefully next year we will see you all in person in one place. And thank you again for joining us today meeting. Simge Khanum, I hand over back to you. Thank you.
Thank you very much, Mr. Muhtashami. Of course, we want to be together, but it seems like this is the most reasonable platform to come together, and it's also saving time for all of us. So hopefully the next year we will have the chance to come together under the single roof. The most important emphasis in your speech was about the works of Turkey, and you said that the aim is to leave no one behind. And you also said that you continue providing services and the support in this regard. I believe since the beginning of the civil war in Syria, Turkey has been one of the top countries admitting refugees into the country. Maybe we have even more than 4 million refugees here in Turkey. And compared to the European countries, Turkey is shouldering a bigger burden. Maybe we shouldn't call it a burden, but it's a huge responsibility. There is the psychological dimension, social dimension, economic dimension, and not leaving anyone behind with regards to access to the services is a huge step taken by the government. And this is showing us what kind of responsibility Turkey is adopting, and also not leaving anyone behind is very significant in terms of the public health. So what are the policies of Turkey in this regard? While delivering health services, what kind of activities are being conducted? What kind of realities there are in the ground? To explain all those, now I would like to yield the floor to our representative from the Ministry of Health, the Department of Migrant Health, Mr. Dr. Kanuni Keklik. Could you please unmute yourself before delivering your speech? This is a very important responsibility of Turkey. We have a huge population of refugees. On one hand, we are dealing with COVID-19 pandemic, and on the other hand, we are doing our best to make sure that the Syrian population, the refugee population, is being affected by the pandemic the least. There is this pandemic dimension, and there are also some other health issues. One of them is the decrease in the fertility. So what have been the policies of Turkey, and what will be the future of the policies in the country? Thank you very much. I wish you a very nice and good day. This is a very important topic. Since this is a very important topic, there are lots of things to say, but we have a very limited time to talk about everything. I'll do my best to wrap up and provide a summary to you all. It's almost more than 8 billion of population in the world, and we have more than 8 million population here in Turkey. And as it seems, Turkey is the most crowded 19th country in the world. And of course, it's very important to talk about the population-related topics. And today, we are here to talk about those population-related issues discussion. And I would like to thank everyone who have organized this event. We are not only the 19th most crowded country in the world. We also have the impact of all the incidents that are happening in the neighboring countries. We also face the refugee crisis, and we also face the migration crisis. We have over 3.7 million Syrian refugees, and in total we have more than 4 million refugees considering the other nationalities. And on top of that, we are also dealing with pandemic. We are going through very difficult days. We have some serious problems because of the huge population and also the different dynamics of the pandemic. And once we handle all of those together, today discussing all these becomes more prominent. Since the beginning of the crisis in Syria, as you know, Turkey adopted the policy of an open door. And we have admitted all the Syrians who wanted to take refuge here in our country, and we have taken relevant measures to provide them with the health services. Currently, the Syrians under temporary protection can benefit from all the services of the Ministry of Health. They can directly apply, and they can have direct access to the services of the Ministry of Health and in the affiliated institutions. And they can again have access to the medicines and all the relevant treatment. In the meantime, we have observed that regardless of the arrangements, there are also other peculiar dynamics of the pandemic, and because of that, we have suffered from many other problems. I can say that when we look at the population profile, among Syrians, the young child population is very high, and in this regard, we do not have directly overlapping areas with regards to population in our country. And in the service delivery, we could come across some problems. But we are working and cooperating with other relevant institutions and organizations to overcome those problems. And about the problems of the Syrians of under temporary protection, we have taken relevant steps. The most important barrier was about the language and culture. Even though you provide health services, you need to do it in line with their needs to overcome those barriers. Since 2015, we have established the migrant health services. As you know, this concept was created for the refugees and migrants. And there we provide the primary health services. Within the migrant health services, in the meantime, we have started the employment of the Syrian employees. And within the time, again, we can say that we have achieved a great progress. And in this regard, we made sure that people have access to the health services in their own mother tongues. This was a very important achievement because this increased the quality of health services. And this was a key factor to increase the quality in health services. And also, we had to intervene in the areas that we have gaps within, and we used the means of our government, partly, and also in the other areas of gaps that we needed the improvement for, we have benefited from the services and support of different projects. I can give you some examples. We have more than 3.7 million Syrians under temporary protection in the country, and these people have been benefiting from our health facilities. I'll just provide you with some figures if you like. In 2019, for the primary, secondary, and tertiary health facilities, more than 17,000 people have benefited. And this number increased to 13 million. And when we look at the first quarter of the last year, we have provided services for more than 7 million only in the first quarter. As you may imagine, these people benefited both from the primary health services and also the secondary health services. This is the good news. We provide the primary health services in the migrant health centers. Our aim there was to make sure that they have the access to the services in the fastest manner. And when we look at the data of 2021, we see that by 56%, the primary health services are being used by the refugees. This is a very important achievement for us and for our health service, I would say. So have we done everything? Of course, we cannot say that we have achieved everything, but very clearly we can say that our government is doing its best to overcome the problems. And when we look at the migrant profile, this is what we have witnessed. First of all, the health literacy was very low among the target population. And also there was the language and the cultural barrier, and also the child marriage and adolescent marriage was also a common problem among the target population. These people suffered from the consequences of the war and of the pandemic, and we see that regardless of that, the fertility rate is still very high in our country in the target group. First of all, we are trying to make sure that they have the access to the primary health services, primary care services. I already mentioned the migrant health centers, and some of those were allocated for the psychosocial support services and also services for the mothers and the infants. And we also employ some personnel speaking different languages, such as Arabic language. And at the current state, the figures that I've provided are very important. Regardless of the impact of the pandemic, as I said before, around 14 million people benefited from the clinic services within the previous years. And this shows us that the services are being benefited to the optimal level. And one issue that I would like to attract your attention to, these improvements do not solve all the problems. As I said before, we have tried to solve the problems with the projects. For example, with UNFPA, we have this project covering some provinces. There we have created mobile units, and through which we are delivering services. Again, within FRIT program, we are benefiting from the support of the EU. And in the process, we are looking ways to make sure that people are benefiting from the services more. We are also trying to improve the health literacy. And also on top of that, through the mobile services, we are trying to reach out to the people that are left in the distant points. And also in the improved health centers, we are improving our PSS services so that the people are also supported with PSS in the migrant health centers. And most importantly, we are providing them with the training sessions and consultancy on sexual and reproductive health. And we would like to provide our services at the optimal level, at the desired level. When we look at the problems for the refugees, from the refugees' perspective, we can say that they have come across many problems, such as the civil war, such as the pandemic, and there are still lots of things to do. We are using the means of our government and also the support of the projects. And with this, as mentioned by Mr. Hassan, we are trying to leave no one behind. This is what our works are showing us. And I would like to thank everyone who put their efforts within all these projects and programs. And I would like to thank Mr. Hassan and his team for bringing such an important topic onto the agenda of today. And I would like to also congratulate all the panelists of today. I wish you a very fruitful panel. Thank you very much, Mr. Kanuni, for sparing time for us. Turkey has a very important priority and responsibility. These figures cannot be disregarded. In the last 5 months even, the clinical services provided were huge responsibilities. It requires a huge amount of time and investment to be allocated. In this regard, Turkey's job is not easy in this manner, and more than 3.7 million Syrians under temporary protection have been benefiting from the health services in Turkey, just like the Turkish citizens. This cannot be disregarded, and I would like to emphasize once again that this is not something very easy. Now we are moving to the panel session, and again, we will handle the issue with a multidisciplinary manner. Once again, I would like to mention the names of our panelists, and I would like to also thank them one by one. First of all, we have Mr. Seyithan Yıldırak, our expert from the Presidency, Department of Strategy and Budget. He'll be talking about the impacts of pandemic. Then we will have Professor Banu Ergöçmen from Hacettepe University Population Studies Institute. She will be informing us about COVID-19 and fertility and the academic research studies and the needs. And then we have Ms. Sema Safir Sümer from World Bank, and she'll be informing us about the investments on women health during the pandemic. And we have Ms. Nurcan Müftüoğlu from Turkey's Foundation of Family Health and Planning. She will be talking about the impact of COVID-19 on women and youth in Turkey. And lastly, we will yield the floor to Dr. Gökhan Yıldırımkaya. He is from UNFPA, and he is the Reproductive Health Programs Coordinator of UNFPA Turkey. And he'll be summarizing the overall discussion, and he'll be also talking about what should be done and what can be done in the short term, mid-term, and in the long term. I'd like to welcome you all once again. Welcome, dear panelists. I believe everyone could hear me. Mr. Seyithan, we are going to start with you. I imagine your mic is on now. Mr. Kanuni provided some figures. Maybe these were only covering the refugees, but we would like to also state that this is a very huge incident. This incident was announced as a pandemic globally, and it has probably had a huge impact on the economies of the countries. It caused some regressions in some economies of the countries. Some sectors enlarged but some others had some difficulties, such as transportation, tourism, and catering. They were almost put on a hold. These inconsistencies were reflected on the economy, on the overall economy. So there is also this dimension of strategy and budget of the pandemic. We are ready to listen from you now. Thank you very much. Distinguished participants, I would like to welcome you all on behalf of the Presidency Department of Strategy and Budget. In the last 1.5 years, Turkey has been going through a very huge pandemic, and it had social, cultural, and economic impacts. And it has been threatening the well-being of the countries all around the world. And today, the world is integrated and the countries are all integrated into one another, especially in commercial sense. And the pandemic broke out in China and then it spread around the whole globe. We know that if it had stayed in China, again, the world's trade would be impacted a lot. It had a global impact now on commercial issues. It slowed down the commercial activities. The central banks tried their best to minimize the effects of the pandemic, and they have implemented some monetary policies. And also in our countries, we have implemented some policies. We said that you need to make people live so that the countries would live. In some difficult times, some groups have to sacrifice a lot. And first of all, this burden was shouldered by our health personnel, especially immobility of people created a huge burden on many sectors. For example, education sector. The education had to be transferred to the online platforms. Sports and arts activities had to be put on hold. And also manufacturing and production needed to be cut down in some areas. And this regression in the economy also was experienced in Turkey. When we look at the impacts of the pandemic in Turkey, the construction sector and tourism sector shrank, but on the other hand, the agricultural sector enlarged. And to minimize the effects of pandemic and to keep the unemployment under control, different arrangements and regulations were realized. Flexible working hours was also introduced, and also some monetary support was provided to the employers and the workplaces, and also additional support was provided for the social insurance and security of the employees. I would like to also talk about the population studies of Turkey. As of the end of 2020, our population reached around 84 million. And we have around 90 million of population considering the refugees and the migrants. Our older population is getting larger and larger, and we see that we are encountering some problems because of that. And let's look at the policies that we have implemented. Until 1965, we had some policies aiming to increase the population. Until 1983, we have moved to planning. And we continued with the population planning later on. And we have the 10th and the 11th development plans. Since 2014 until today, when we look at the development plans, and I would like to talk about the policies, and we have some concerns about the aging population. Therefore, we have started to support the fertility. We have started to work on the harmonization of the family life into the social life. And we have given more rights to women. And we have also supported women with regards to the fertility, birth giving, and also we supported women with the child care.
Starting with the research that we carry out, we can see the population research, because once in every 5 years since 1969, Turkey conducts research about fertility, the maternal care, mother and child health, and it is guiding when it comes to the women empowerment in Turkey. When we look at the impact of the pandemic on the population, we can talk about the 1.3% of population rate of Turkey, which decreased down to 0.55 in 2020 because of the COVID-19 pandemic. So 1 million was the average increase for the population every year, but it was recorded as 450,000 only in 2020. This is again an impact of the COVID-19, so we can talk about a decrease in the fertility rate of Turkey as well. Although the pandemic mostly impacted those elderly above the age 65, we can still look at the loss of lives at every age group. So we can better understand the impact of the pandemic when we make more research about the population. While concluding my remarks, I would like to thank UNFPA for their kind invitation and to you, dear participants, for your kind attention. We would like to thank you, Mr. Seyithan Yildirak, for especially talking about the services rendered in the pandemic process and its impact on the reproductive health. Now let's focus on the academy more. We have Professor Banu Ergöçmen from Hacettepe University Population Studies Institute. Welcome, Madam Ergöçmen. You will be sharing the recent studies from a population point of view and with an extension of a pandemic. Of course, we were a little caught off guard, caught unprepared all around the world to this pandemic. So these gave birth to certain needs. I believe you will mention them as well. The floor is yours. Thank you very much, Madam Moderator. I would like to initiate my remarks by thanking UNFPA for, first of all, organizing this beautiful day and also for kindly inviting me to the country representative, Mr. Mutashahami, first, and then to the whole UNFPA. If you allow me, I would like to share screen so that you can see my presentation. I think it works. All right. So we are discussing the global pandemic and fertility on the World Population Day. As the Mr. Representative mentioned during the opening very well, this is an important topic, and every year we have a different theme, and this year's theme is women's health, or in other words, reproductive health. But of course, what makes this topic more specified in today's context is the global pandemic of COVID-19 that has been ongoing for a year and a half today. Of course, the COVID-19 global pandemic has made everyone feel its presence both economically and socially, because it is a healthcare problem that changed the way of life for everyone. And this means the population is being affected by the pandemic from a demographic point of view. The birth, the death, the migration, and especially the mortality and fertility from a migration perspective have been affected by the global pandemic a lot. When we look at the history of the pandemics, we once again understand that population sizes are impacted throughout the history by the pandemics. The increasing mortality rate is also meaning that the expected lifespan is changing and fertility is decreasing. So the world is always impacted by the pandemics. But let me give you some examples from the COVID-19. In northern Italy, which was the most impacted area in the world, they carry out a study, and the life expectancy at birth is one of the most affected impacts according to this study. And for men, 2 to 3.5, and for women, 1.1 to 2.5 year decrease is the loss for the expected life at birth. So this is the most drastic drop at the life expectancy that we see in the world since World War II. Natural disasters, wars, and conflicts, even wars, cannot cause the death of so many people all at once as much as this COVID-19 pandemic. The viruses and the pathogens act different than the disasters and the wars. It is considered that the Black Plague in the 14th century or in influenza pandemics, the mortality was at about 100 million. From a demographic point of view, we know that compared to those centuries, today the world is more populated, which means that the pathogens can create a bigger impact. The virus is, I mean, in the pandemic in 2018, the population, back in those times, in those centuries, the world population was only 2 billion, but today it is 8 billion. And even then, the pandemics affected 1/3 of the global population, which means that today's pattern is understandable. The demographic changes should be assessed from a pandemic point of view to understand if they make us more vulnerable or not. Well, especially in the urban settlement areas, the population is higher. According to Population Reference Bureau's 2020 Global Population Data Bulletin, it is indicated that in many cities with low and medium income, there was a limited access to safe water and sanitation, and the fact that the dense population was settled in irregular settlement areas, it became almost impossible to take the preventive measures such as social distancing and hygiene and sanitation. The average household size, or the fact that multiple generations live in one single house, or the rate of the elderly population in one society are among the factors that we need to look at to better understand the pandemic's impact on the population. All along the history, resulting from the famine and pandemics, the mortality rates decreased first and then increased later on, which was followed by an increase of the fertility rate. For example, from 1918 to 1919, the Spanish flu, which was the biggest pandemic of the previous centuries, caused a decrease by 13% on the population of the United States of America. And of course, probably today's pandemic will also shape the future's world from a fertility point of view, which means the field begs for further studies. Well, from Turkey's specific fertility point of view, we don't have clear data in hand yet, because forecasting is depending on reliable data, and March 2020 was the onset of COVID-19 and the pandemic is still ongoing. So in order to make reliable forecast, we don't have enough reliable data yet. On the other hand, we do not have a large sampling in hand in order to reflect the negative impacts of COVID-19 on the society. There are researches, but these are small-scale studies, unfortunately. They are not reviews or meta-analyses. And we also need the mortality statistics. The Turkish Statistics Institution has not yet published the mortality data that was supposed to be published in June, so it's delayed a little bit. We are expecting the results. Of course, as you know, following the pandemic in 1 to 5 years, the fertility rate can be increased with comprehensive approaches. And among the factors why the fertility is impacted negatively can be considered as the fear of infection, less social gatherings, and less pregnancies, and the pandemic in itself. So from Turkey's point of view, again, we thought that COVID-19 would not change the fertility tendencies and predispositions, because the COVID-19 affected elderly population most, and especially the males. And the pediatric deaths, pediatric mortality is not that drastic with COVID-19, but we know that the marriages were postponed in Turkey. I mean, in Turkey, marriages are quite common, and the children are made in marital relations, and there is an unchanging pattern in Turkey. After the marriage, in the following 1 to 1.5 years, people have their first child. Even though the marital age is late and old, still following the marriage, in the first 1.5 years, the first child is made. However, the marriages are postponed in Turkey. From a compulsory physical distance measure point of view, we can see that the women most of the time live at home remotely, and the children also stayed at home because the schools were shut down for a really long time. We will see the reflection of this on the parents as soon as possible, and we need to understand if their intentions for making children changed or not. Well, it was important to understand how couples had or had not access to the family planning and reproductive health services. For example, were there any undesired pregnancies? Were there couples that were being treated to have kids with assisted reproductive techniques, and were those interrupted? We need to know these, and especially those who live in metropolitan cities were faced with more, major economic challenges, with increased unemployment and decreasing purchase power. All these came with financial struggles that brought negativity over the community, and everyone knows that having a child comes with a certain financial cost. Therefore, we don't know if the people's intentions to have children changed or not, and we believe that they might. So while concluding my remarks, I would like to underline the gaps regarding data and information. When it comes to COVID-19, we still have a gap of information for the fertility predisposition and other topics about reproductive health and so on. The research that was referred to by the previous speaker is dating 2018. Mine also, therefore we need more up-to-date studies and researches. We need a data-based policy in order to overcome the uncertainty and in order to overcome the possible changes in the mentalities. We need reliable data that will be guiding and that will be the foundation for reliable policies. We need research for both qualitative and quantitative data collected by those methods, including the mixed methods, and we need both monthly and retrospective data, and we also need to have information not only for the Turkish nationals but also for the Syrians living in Turkey as well. That's all from my side. Thank you very much for your attention. I hope I did not exceed my time. No, you did not. Thank you very much, Madam Professor. It's been such a comprehensive presentation, although your time was very limited. I would like to thank you once again very much. You talked about the importance of information, and it is important to collect data and interpret that data in order to come up with permanent solutions, especially in the challenging times that we are experiencing today. Maybe some of that data can be given by the next speaker, the humanitarian development expert from the World Bank, Madam Sema Safir Sumer. Please unmute yourself before you start speaking. Of course, certain investments were made in this process for the reproductive health and women's health, but were those enough, or do we need more? And we talk about the free choice. For years, the men and even the system have been intimidated by the possibility of women making their own choices. So I would like to ask you, Madam Speaker, were women able to make their own choices? Thank you very much. The floor is yours. Thank you, Simge, Madam Moderator, for giving me the floor. I also would like to thank UNFPA for their kind invitation to this nice organization. I would like to get started by some striking numbers. We talk about numbers, and what's important when it comes to the women's choices and rights is their effective integration to life, both social life and economic life. So here comes the striking statistics. According to 2016 report of International Labor Organization, ILO in short, they studied a scenario as follows. If women were employed equally as much as men, and if women participated in the labor market as much as men, what would happen? This is the question. So they foresee that in 2025, this would contribute to the global economy as $28 trillion. So when it comes to the gross domestic product averages annually, we talk about a $28 trillion contribution, sorry, a 26% contribution to the economy. %27 in India and 36% in Egypt are the contribution of women to the economy in their respected countries, which was single digits a few years ago. So the more they participate in the labor market, the more their country's economies improve. And from a developmental point of view, I would like to come back to the women's health, because there are many factors that influence the integration of women in the labor market. For example, having equal and equity-based access to healthcare by women. This is important not only for women, but also for their families as well, because the more they have access to such services, the more they can self-actualize their potentials, and the more they can contribute to the society that they live in, socially and economically. After these general remarks and after drawing your attention to this important topic, I very rapidly would like to share a snapshot of Turkey. Of course, Seitan and Banu and Kanuni already talked about this a little bit, but I first of all would like to share a snapshot of Turkey and then link it with women. Well, Turkey's population is aging, so Turkey is not exempted from the global trends of not having babies, and urbanization is really, really fast in Turkey. 75% of the existing Turkish population live in urban areas, and when it comes to the disease burden, we also experience certain changes, just like the rest of the world. For example, the chronic diseases increase. According to a disease burden study of 2004, certain statistics were published as a result of the study, and 79 to 80% of all cause mortality in the world is due to chronic diseases. So here the focus must be on the woman's side most of the time, because when it comes to the communicable diseases, the burden on the woman's shoulders is really high. Let me share two statistics here. Turkish healthcare study conducted in 2019 indicate that obesity increased among the Turkish population, which is 25% among women, but only 19% among men. Diabetes is the second study topic. The participants were asked about the most major healthcare problem in the last 12 months, and women said by 12% it is diabetes, and only 8% of the men said it is diabetes. I don't know how the experts would interpret this, but when it comes to women's health, when it comes to the chronic diseases especially, maybe it's a little exaggerated to say that the situation is a little alarming. So I'm not saying that, but I'm saying that we have to reflect on it. We have to think about these issues. After providing this general picture, this general snapshot of Turkey, I briefly would like to talk about the projects that are supported by World Bank, and then I will come back to the women's health. There are two ongoing projects supported by World Bank. One of them was initiated in 2015, which is strengthening and supporting the existing healthcare system in Turkey. And last year in May, the emergency healthcare project for COVID-19 was initiated in Turkey. This is more and more focusing on the efficient fight against COVID-19 and efficient measures and so on. But from a women's health or reproductive health point of view, the project is also focusing on strengthening and supporting the healthcare system in Turkey, which is the very first project. So there are some subcomponents under this general project, which include activities for supporting and strengthening the reproductive healthcare steps. For example, healthy life centers are supported by the World Bank, and this is a complementary system, complementary to the community health centers, which is the primary care centers, and very new these are, and these right now we have 209 healthy life centers, and multidisciplinary healthcare providers work at these centers. They provide patient-oriented and special healthcare services. And from a reproductive healthcare point of view, I can talk about some important services. For example, combating chronic disease risk factors, management of chronic diseases, prevention against chronic diseases, nutrition consultancy, psychological consultancy, reproductive health consultancy, cancer early diagnosis screening and training activities, physical activity consultancy, and social workers. So these multidisciplinary people provide multidisciplinary services, and these are among the services that are supported under the Healthy Life Centers in Turkey. And the success of these Healthy Life Centers are also being monitored by us based on certain indicators, which I would like to share with you. The satisfaction percentage from the Healthy Life Centers was detected as more than 84%, according to a governmental study of 2018. So we know that when women visit these Healthy Life Centers, they become the biggest portion of the visitors, especially when it comes to the cancer screening and civil training or population training for cancer. The majority of the participants were women. Before the pandemic, the visitors numbers were only 10 million, but due to the global pandemic, the numbers decreased slightly, which was expected because we had lockdowns and long shutdowns. So the visitors number decreased from 10 down to 6 million. And as a result of the lockdowns, the screening rates also decreased, especially for the breast cancer and cervix cancer, the cervical cancer. But with a pandemic slowing down and hopefully coming to an end, these visitor numbers will hopefully increase back up and reach the desired levels. So after this general information, I would like to talk about the needs and what should be done from now on in the future. And actually, I will refer back to what Dr. Kanuni and Professor Banu said, because what they said is quite very much overlapping with what I want to say. Kanuni Keklik, for example, talked about the health literacy, and health literacy is very much needed to be improved, not only for women, but for the whole society. But considering the critical role of women within the family and within the society, the outcomes of health literacy can be better benefited by increased literacy among women. And this is not only for the COVID-19, because during the COVID-19 pandemic, we have seen this problem of infodemics, which is disinformation. Hopefully, with more health literacy, this disinformation and infodemics will be prevented, especially among women, because they will have their families, and we will come a better way after these improvements. Let's come to the second issue, and And for example, 56% increase Kanuni mentioned in the use of primary care centers, both by Turkish nationals and by the Syrians as well. We understand that the awareness raising activities are quite useful in this regard.
I have mentioned, also Mr. Kanuni mentioned, with the lockdowns, with the self-isolation, there have been many delays in the service provision in health. Actually, in many areas, this created the need. There are many unmet needs also in the health sector. Probably after pandemic, we need to also focus on that. And lastly, we all know that the life will never be the same. We all say that after the pandemic, and this is also true in some dimensions of the health sector. In this regard, the digital technologies and telemedicine technologies will be widespread, and their dissemination will be important for women's health, for women's reproductive health, and in an overall sense for the public health. These will be important, and we need to focus on those more and more. Thank you very much. We would like to thank you very much, Ms. Zafer, for all the explanations that you have provided. We are all living through those dates, and we are identifying our own gaps and missing points. As you mentioned, we had previous pandemics in the history of humankind, but now we have a bigger population in the world, and now the transportation networks were improved, and because of that, it had a huge impact in the whole world. And for the future, we have some uncertainties we are going to encounter with some areas that still will need improvement. The next speaker is from the foundation, Nurcan Müftüoğlu. She is from the Family Planning and Health Foundation, and she'll be talking about the women and youth and the impact of COVID-19 in Turkey on these target groups. Could you please unmute yourself and deliver your speech, please? From where our previous speaker left off, could you please pick up and inform us on the relevant topics? Of course, thank you very much. Hello, everyone. I would like to thank UNFPA for organizing this event on the occasion of the World Population Day. I would like to congratulate them once again, and I would like to thank them very much for their kind invitation. Pandemic affected the economic and social dimensions in the world, and it has also affected the health sector. There has not been any single country that did not have the effects of the COVID-19 pandemic. When we look at the development targets, development objectives, we know that from the UN agencies, we are also lagging behind in achieving those development objectives and goals. And we also knew that the pandemic would have some negative impacts on the woman's health and the reproductive health. There are millions of unwanted pregnancies. Even during the 6 months lockdown, we know that there have been 7 million unwanted pregnancies. There has been also an increase in the death rolls of the mothers and the infants. And we also know that domestic violence has been on the increase. And also, there have been some delays in the service delivery for women's health. This list is going further and further, but this is a reality that the pandemic deepened the inequalities. The mean is that those groups who had difficulties in accessing services had even bigger problems in accessing services. These groups may involve women, children, the poor, LGBTQI individuals. The references are to generally the year 2018, because we have conducted a very important research study back in the time. And by the reproductive health platform, a comprehensive research study was launched Actually, there are two comprehensive studies. One of them is by the Child Research Center. It's about reproductive health and sexual health report of Turkey. And the other one is taking place in the pandemic process. It's in cooperation with the Boğaziçi University. It's a qualitative research study being conducted, and it's about the current status of the reproductive health services delivered at the current times. Also about the well-being of young people, UNFPA cooperated with a foundation, and I would recommend you to have a look at the relevant research study. When we look at women's health and the infant health, and when we look at the pandemic period, it's important how we started the process. Before the pandemic, reproductive health and sexual health services provided in a scattered manner. We have the center units, and they provided based on the performance evaluation, and family planning were not covered, and also family consultancy and information provision were not covered because of the lack of time, and the primary care service providers were not participating in the reproductive health services delivery. The number of those centers decreased day by day, and also the family planning clinics closed down, and healthy life centers and new service delivery areas started to be open. And also the access to the contraceptives have been very limited in this process, as we all know. Mother health and sexually transmitted diseases treatment had a very strong structure, but with the elimination of certain centers and with the decrease in number of those centers, the family planning and the access to contraceptives have been left in the background. Unfortunately, they haven't been that prominent. Because of the lack of programs, the young people and adolescents were left under the risk. When the pandemic first started, some regulations were made to improve the access to the medication, especially by those people suffering from HIV, but still there was no central planning. And in this area, expert health employees were transferred to the combating pandemic area, and therefore the available capacity had also a negative impact on it. During the pandemic, with the health service providers, some negotiations were made, some consultations were provided, and they have informed us that the supply of contraceptives has been very problematic, and it has even been stopped in the last 1 year. As you know, before pandemic, we had this organized structure where we provided consultancy on motherhood and on access to contraceptives. And in the last 5 years, the need doubled and it increased to 12%. And still, there are those women who do not want pregnancy, but they are still trying to benefit from the traditional methods of preventive pregnancy. And still, we come across the unmet need for family planning for these women. We look at the latest data, and it shows us that there is still a huge need. And for these needs to be met, we still need the huge support of the public sector. There is this inequality of revenue, of income for different target groups in our country. And this is also deepening the gap with regards to the inequalities among different target groups. We need the support of the public sector to eliminate this gap. The pregnancies, the tendencies may change during the pandemic, and with the loss of income, also there has been some limitation to the access to the contraceptives. And we know that because of all these reasons, some people were exposed to domestic violence and gender-based violence more and more in their households. And this is showing us the need for the further access to the sexual and reproductive health and services, especially during the pandemic. Also, the termination of the pregnancies, unwanted pregnancies, has been an area that we have focused on in cooperation with very different organizations. And there has been also a research study released. And as we all know that these services were not compulsory, but optional. Previously, the accessibility rate was 18. Of course, again, we are putting here the emphasis by the public sector. During the pandemic, again, this has been very optional, and it was up to the decision of the health workers. And with the travel restrictions during the pandemic, we know that the effects have been more negative. And also some pregnancy services were put on a hold in some public hospitals. And we know that some districts suffered a lot more because of the limitations to the access to the transportation. And it even caused some barriers with regards to the having access to the birth services. And during this time, we had some problems in the observation of the pregnancies, in improving the treatments for the elimination of the problems. And for the diagnosis and the treatment of the sexually transmitted diseases, we were having difficulties already, but now the preventive measures have been left in the background, and it's even deepening the problems. During the pandemic, especially women suffered a lot, and their access to the health services have been limited. And we know that the number of centers decreased also because of the other priorities of the governments. Especially the sexual and reproductive health and services were provided in a scattered manner. I would like to emphasize once again that our country's effort has been dating back to many years ago, but still we have a very huge accumulation of knowledge and experiences. We also have a very strong healthcare service structure in our country. The sexual and reproductive health and services should adopt a rights-based approach and should adopt a holistic approach. And all of these should be provided by the public authorities, but in this regard, I can say that we have the resources available. During the pandemic, about the rights and services, there are those obligations put forward by the internal law and also by the international law instruments. But during crisis, as we all know, this may be disregarded from time to time. During the pandemic, we need to focus on those even more, and we need to be prepared about how to deliver such services during the crisis. To protect the rights and services, we need to make sure that the cooperation is provided and ensured by the public authorities and the private sector. Young people and adolescents should be informed more on their bodies, and they need to be able to make informed decisions on their bodies thanks to the services that they get. While concluding my words, I would like to talk also about the Nairobi summit. For the year 2030, there is this promise made by the countries. I'd like to emphasize this promise while concluding my words. According to the promise made by the countries for the summit, the unmet family planning needs and gender-based violence would be eliminated in the future by the year 2030. So we are all hoping for this promise to be realized. Thank you very much for all the sharings. Of course, we totally agree with all the things that you said. Now we are moving to the closing speech, which will be delivered by Dr. Gökhan Yıldırımkaya. Hello, Mr. Gökhan. Last year, also, we were together on the occasion of the World Population Day. Back in the time, we were enjoying the normalization, but now we are almost facing a new wave, the fourth wave. We are curious whether we are going to face a new wave as the whole world. On one hand, the vaccination is ongoing in Turkey and also in the whole world. And on the other hand, therefore, we are also very curious, thinking that maybe we would go back to the normal life. You have listened to all the speakers, and also as a person working for UNFPA. You are very knowledgeable about the situation. You are going to share with us the available data, and you'll also share with us your vision for the future. You'll share with us what is foreseen, but in an overall sense. This process has been a very negative, has been affecting girls and women negatively. Maybe you would like to also mention all those. Now I would like to yield the floor to you for your speech. Thank you very much, Ms. Simge. I think this will be also the easiest and also the hardest speech of my life, because the previous speakers had this perception of 360 degrees. They have handled the issue from all the possible perspectives. I would like to thank all the participants, Mr. Seitan, Ms. Banu, Ms. Sema, Ms. Nurcan. It's great to be with these wonderful speakers. They have enriched the content of our discussion. We would like to also emphasize that 1/5 of the 21st century is already left behind. And we have experienced maybe the hardest 1.5 years in terms of development, health, economy, rights. It's very obvious that we have undergone the most difficult times, and you have provided a very good reminder. In the beginning of my speeches, I always reminded of you that about the data on women, on reproductive health, we have had many gaps. And sometimes because of this lack of data, we used to think that there has not been any negative impact on these areas. But if we focus on the right-based approach, only then we can achieve better results. If we do not cover all the target groups, then we wouldn't be going through that desired dimension. We have experienced this. Last year, we were a bit more at ease, but compared to the last year, we can say that we are good at the vaccination. The numbers, the figures are very good in Turkey. We have one of the best vaccine programs in the world, but because of social and economic reasons, the mobility started to increase again, and the risks may be faced also in the autumn season. Of course, we hope not to have this, but we need to be prepared. This was put forward very easily. Such pandemics, mentioned before that, have an impact on the service delivery, on access to the services, and on logistic needs. We needed to know that even beforehand, even before the pandemic. Mr. Seitan also emphasized the importance of that. With the refugees, we have around 90 million population, and all the health workers prioritized the struggling with pandemic, combating with the pandemic. Maybe if it wasn't for their efforts, we wouldn't have such fruitful results. And also the scope of the services narrowed. The prioritization of people changed, and this is something very expected because the workload of the health workers increased, the workload in the health sector increased, and also we need to postpone some needs that were not prioritized. This was something expected. In automotive, in manufacturing, the needs changed, the logistic needs changed, the manufacturing and production needs changed, and some limitations have been introduced. Also, sexual and reproductive health and family planning had their share. And the short-term, mid-term, and long-term policies of the countries changed as well. Once we put all these together, we realized that, also mentioned by Ms. Nurcan, we realized that we had to postpone some services. We had to postpone the delivery of some services in certain areas. But in the meantime, we have also learned a lot from the process. Once the effect of the pandemic lessened, on the other hand, the service providers started to go back to the previous state. The postponed services started to be strengthened because they have been postponed for a very long time. And as mentioned by Ms. Nurcan, we started to focus on the strengthening of logistics. And on the other hand, this service providers started to go back to their previous states. And once we achieved that, I believe that we can go back to the regular meeting of the needs as we did before. We have those family planning centers, and they had to also put on hold their services for many months. And they started to go back to the previous version day by day. Today, for example, we have the wedding ceremonies, but previously we didn't even have those. And just like this, the fertility choices and the birth giving choices will be also changing once we go back to normal. As UNFPA and as UN organizations, we have been participating in global programs. We have these reproductive health services delivery, especially during crisis. Since 2012, as UNFPA, we have been cooperating with the public authorities, and we have been implementing various programs. We are very thankful for that. They are not here today, but we have Ms. Tuba, the head of the Women's Health Department. Thanks to her cooperation, we have integrated this aspect to the many multi-dimensional programs. I am underlining this once again. We can go through many disasters, but none of those would have such short-term and serious impacts. Therefore, especially these times were very critical, and we needed to be prepared. Some of the services were meeting many needs, but some of others showed us that we needed to be more prepared. This is not the case only for Turkey. This is the case for the whole world. Once we look at the calculations, we see that every month, 1.5 million women or couples had additional unmet family planning needs, and many children, unfortunately, had the impact of child marriages or forced marriages, or they have been exposed to a kind of different violence. Once we put this all together, this is very important. We started to overcome the impacts of the pandemic, but still we will live with the pandemic for a very long time. I don't want to look in the past. I would like to look in the future. This is what pandemic showed us. While combating with the pandemic, we need to also realize the importance of not postponing the needs for the women's health services. Because once you postpone the services, this would be encountered in the future more and more. We need to focus on the contraceptive materials production, and we need to also focus on their distribution, their transportation, and we need to focus on the continuous access to those contraceptives. Because in the future, if we do not do so now, we will have lots and lots of consequences. Just like in the treatment, just like in the access to the medicine, we have learned that this is also very important for the women's health. I would like to thank the Ministry of Health. Some small-scale programs started in mobile services, among the COVID services. Also, women's health services were integrated. This is what the Ministry of Health showed us. And we learned that these all could be done together, and such models can be implemented in the future as well. During a humanitarian crisis, all these dimensions can be handled together. This is also true for the development programs, also true for the migrant health programs. And also, through the distant training sessions, the newcomers in the employment could be enhanced with regards to their skills and their competencies. And with the investments of the Ministry of Health, face-to-face trainings even started. What does it show us? It shows us that with regards to the trainings, with regards to the improvements and the vaccine, we will be stronger, and all of these can go hand in hand in the future. Lastly, I would like to underline this. There are still lots of things that we do not have any clue about. There are lots of things that we do not know anything about. 2023 will be the year of a new survey, and this survey will be covering the fertility choices, unmet needs, women's health delivery, and hopefully it will show us the impact of COVID-19. We need to know both in a qualitative manner and in a quantitative manner. We need to know about the data so that we can be prepared in the short term, mid-term, and in the long term. And in this regard, hopefully we will be prepared and there will not be any additional workload on top of the load introduced by the COVID-19 already. Hopefully we will keep the active labor force, and hopefully we will be more prepared and stronger for the future, and hopefully we will not miss anything, and we will provide a continuous service delivery. This is only possible with these multi-sectoral cooperation, support and exchange. And we shouldn't leave anyone behind, and in the 21st century Turkey will be at the desired level in the delivery of health services and women's health services. On this occasion, I would like to also say that we have upcoming holidays. I wish you a nice holiday time for the Bayram and after the 15th of July. And hopefully after the pandemic and after the holiday time, the days will be good for all of us in terms of our health and fruitful work. We were actually foreseeing a half an hour, 1.5 hour duration for our webinar. I would like to yield the floor once again to Hasan Muhteshami for the closing speech. Thank you very much. Mr. Gökhan, I totally agree with you. You mentioned the pandemic and its impact on the service delivery, and this is a reality that we do not have the luxury to postpone the service delivery anymore, because once we postpone something today, it will bring along the additional cost for the future. And the time is passing on, and maybe the problems will get bigger and bigger. Their dimension will be deepening. Therefore, we shouldn't postpone any health problem and any service delivery. Once again, I would like to remind you of that, and I'm now yielding the floor to Mr. Hasan Muhteshami for the closing speech. Over to you, sir. It has been a very nice webinar. What would you say about it, sir?
Thank you, Singe Hanım. I really appreciate it. It was so rewarding to listen to all these presentations and thoughts. It is indeed actually reiterated the fact that COVID pandemic was really a multifaceted, very complex global pandemic that has affected very many areas of our life. And need to be planned and thought about for some years. We need to do studies, we need to do plans to understand the depth of the impact of the COVID pandemic on different areas, including sexual and reproductive health and rights and population dynamic, and then plan accordingly for the years to come. One important element, I said it at my welcome remarks, and I repeat it at this closing remark, is that at the centerpiece of whatever we do, in terms of our studies, creating knowledge about these issues, planning the strategies, planning for budget, planning for programs, planning for studies, we need to remind ourselves repeatedly the centrality of the women's right in the whole processes. At the end of the day, whatever our plans is in terms of sexual reproductive health and rights should be centered around the women's choice and their decision about their fertility and their body integrity and future of their lives. So that's the element of concern that usually post-disaster, post-pandemic, post-civil war, post-natural disaster, we see the elements of rushing to try innovative ideas to get back to some sort of normalcy prior to that disaster. And in the midst of this, the rights of women and girls need to be taken care and always be centerpiece of our discussions and thinking. So with that, I really appreciate, first of all, your outstanding moderation. It's an honor to work with you, Singe Hanım, and government representatives' outstanding contribution. I really appreciate and recognize their contributions, as well as colleagues and fellow academicians from Hacettepe University Population Studies and World Bank and the Family Planning Association. We really, really appreciate your contribution and hope this seminar or this webinar would have been useful for the audience. Thank you so very much. Yield back to you, Madam.
Thank you very much for gathering us all together. I believe it's been such a fulfilling webinar, such an informative one. Thank you, Mr. Hassan Motoshahami. Of course, before the webinar, we were just chatting with my dear colleagues and friends from the Turkey office of UNFPA, and I made a joke, and I wanted to actually make the same joke at the beginning of the webinar. Then I was not sure if it was appropriate. Due to the global pandemic, the fertility rate is decreasing in this part of the world, and I do my best to make sure that fertility rate is not decreasing in Turkey, because I just had a boy right before the pandemic, and after the pandemic probably I'll have the second. So maybe this can set an example to many people, especially if they are full of fears when it comes to bringing children to the world, especially under such challenging circumstances. But children are the best creatures in the world, and let's all hope and praise for the future days where the women will be equal to the men, and gender equality and reproductive health are among the core values of UNFPA. Therefore, I hope we will have a future with those two as well, and even not future, we will have a today with such core values. Thank you, Mr. Motashahami, for gathering us together. Thank you, Mr. Head of Department, Dr. Kanuni Keklik, Head of the Department of Migration Health from the Ministry of Health of the Republic of Turkey, for sparing the time and sharing valuable information. From the Strategy and Budget Office, Mr. Seitan Yildirak, thank you for your time. Professor Banu Ergöçmen from Hacettepe University Population Studies Institute, thank you very much for the academic perspective you provided to us. The humanitarian development expert from World Bank, Madam Sema Safir Sumer, thank you very much for everything you shared. Nurcan Müftüoğlu from Turkey Family Health and Planning Foundation, thank you very much for especially focusing on the vulnerabilities of the women and the youth. And the Reproductive Health Programs Coordinator from UNFPA, Dr. Gökhan Yıldırım Kaya, thank you very much for your presence and your contributions. We all agree on our wishes for the future. Hopefully in next year's program, we will gather in a better world. It's been great. It's been very beneficial. You can see and watch and find the webinar on the UNFPA's official YouTube channel. So if you missed anything, you can find the link in the following days after our seminar as well. Please share the link with those who you think this webinar would be beneficial for. The link will stay on YouTube. Thank you very much for your presence. I hope to see you again next time. Have a nice day. Thank you.